Hi everyone, Alex Del Valle here with Gary Merlino.
Hi everybody.
Just probably haven't heard from us in a while. We've been talking about sending out another quick video clip about where we are in terms of the COVID-19 virus. We've gotten a lot of positive feedback regarding our first couple videos, and so we just kind of wanted to reach out to you guys. Obviously things have changed a little bit since the last time we did one of these videos, as you guys can tell, in terms of our mask wearing and our social distancing here. But basically, there's obviously some topics that people have been repeatedly asking us about, and we've been meaning to put out this video again for a couple days just to kind of give you guys some information and answer some of the questions that we know that a lot of people have. Probably the biggest question that we're getting nowadays has to do with testing. Testing is something that really has evolved incredibly during the course of the last 6 weeks in this country and actually across the world. Testing was honestly one of the biggest challenges that we faced early on, and it still continues to be a challenge. And so there's a lot of misinformation out there about what constitutes testing, who should get testing, what type of testing we should do. So we just kind of wanted to briefly touch on that subject. In terms of the testing capabilities that we have, and we do have them in our office, we have the ability to do the nasal swab testing, which is the PCR testing, which really should only be done in those patients that have had some symptoms consistent with COVID-19 infection. The other testing capability that is newer has started to be more common and more widely in use is the antibody testing. The antibody testing, the first one that we had were little point of care testing kits where we would do a finger stick, check the blood here, and unfortunately the accuracy of those tests is probably not as good as we would want. So much so that the Food and Drug Administration really has kind of backed away from encouraging the use of those point of care tests. The other ability that we have is basically a serum test, which means basically we draw blood, and specifically what we're looking for there is IgG. IgG, or immunoglobulin G, is basically the antibody that results after a infection. And so specifically we're looking for the SARS-2 COVID IgG. Typically it takes about 14 or so days for that IgG to form in your blood, and what we're finding is that a lot of people that had illness don't necessarily form the antibody. So really, in terms of the antibody testing, we're kind of up in the air right now. What we recommend is that you have that discussion with us as your primary care doctors, and every patient is a little bit different based on exposure, the absence or presence of symptoms. Did you have symptoms at some point in the last 3 months? So based on the answers to those questions, we can basically decide together whether you would benefit from antibody testing. And that's basically where we're at in terms of the testing.
Yeah, and agreeing with what Alex says, the whole IgG we're still learning from it. We have patients that the entire family has had COVID infections and documented, and only one of the members makes an IgG. Now it does take a couple of weeks. You first make an IgA, then you make an IgM, and then the IgG is the long-term antibody that's supposed to give you immunity. So not everyone's producing IgGs, and I think it really should be for the person that feels that they had it, but keeping it as a discussion with your primary care doctor and seeing if you're the person that should have that test done.
Yeah, and the one thing that I want to add to that also is that there's a lot of talk as to whether this IgG affords you some kind of protection in the future, whether if you become re-exposed to the virus. The answer is we don't know. We don't know whether it gives you partial immunity or complete immunity or any immunity. Is really up in the air right now. And again, it's been one of those things that's been really particularly challenging with this virus, is that we kind of don't know how our immune system is responding to it. So because of that, I think we kind of agree that IgG testing is really, or antibody testing is really not really indicated across the board for most patients. If you have symptoms, that's a different story. If you have direct contact or first-degree exposure to somebody that was confirmed with the illness, that's a different story. But if you're just somebody that's out in the community and you've been taking care of yourself, wearing masks, socially distancing, and you haven't had symptoms, I think the recommendation now is probably that you don't get tested with the antibodies.
Going out now, as opposed to how we discussed protecting yourself in our first video, I think things are very similar. I think we still need to keep our guard up and assume that it's best to assume that people around you do have this virus. That would keep your guard up. I think going out, you should always wear a mask when you're going to be in public or anytime you're near anybody. Wearing gloves is a good idea. I think if you're going out to a store, gloves not only protect you from getting the virus under the skin, but it also usually prevents patients from touching their face. They're more conscious of touching their face or their mouth when they have gloves on. It gives you the ability to go into a store, take them off when you get inside your car, gel your hands, and know that you're clean and safe. Going into and always keeping a distance from other patients, obviously, other people in the hospital, or other people in a store, or other people in a line, keeping a safe distance. I think going into your house, you should always derobe as much as you can if you've been in contact. Take off a sweater, take off your shoes, leave them in the front of the door. Wipe your hands and your arms down with antiviral gel or hand washing. I think my concern with everyone going out now and restrictions being relaxed is people letting down their guard. So I think that you still have to keep your guard up, and it's not hard to keep yourself, it's not difficult to keep yourself safe from this virus.
So again, without a doubt, I think our biggest hope in terms of returning to a normal life is the development of a vaccine. As I'm sure you guys have heard in the news, there is a lot of active research going on across the world. Oxford University, in conjunction with AstraZeneca, which is a major pharmaceutical company, is probably one of the ones taking the lead. But even here in this country, there are a lot of pharmaceutical companies that are very much involved in immunotherapy and development of vaccines that are being very, very aggressive. Best case scenario, though, we're looking maybe the end of this year, but more than likely sometime next year, so in 2021. In terms of the treatments that we've seen in the hospital, as I'm sure most people know, there has been obviously a lot of press about the efficacy of Plaquenil, or which is a medication that we've used in lupus patients for many years in conjunction with azithromycin, which is a Z-Pak basically. Yep, so the hydroxychloroquine, which is the Plaquenil. We had a lot of early indications, particularly in patients that were being cared for in Europe, particularly in Italy, and a lot of the early information that we were receiving was that there was some benefit to that combination. As recently as a couple of days ago, though, the New England Journal of Medicine did publish a placebo-controlled trial that really didn't show any major efficacy or improvement in terms of outcome in those patients that received the Plaquenil and the azithromycin versus not. So again, that's one of those therapies that we're kind of in the air about, but based on this latest study that came out, we don't think that there's a major benefit. The other big one that we've heard about in the press and does appear to be more positive in terms of outcome is Remdesivir. Remdesivir is an antiviral medication made by Gilead, which is another major pharmaceutical company. Remdesivir had been used previously in Ebola patients, and so there was a study which has shown that there is a significant improvement in the number of days which are symptomatic with this illness. In terms of mortality itself, in other words, are you more likely or less likely to die or not die if you get the therapy? It didn't really show a major difference, but it did show a difference in terms of the number of days that you're sick from this illness. In general, it actually cut down the number of total days by about 5 or 6 days, somewhere between 14 to 15 days if you didn't get the remdesivir, as opposed to 8 or 9 days if you did. Limitations with remdesivir, unfortunately, is that it's an IV medication. It can only be given in the hospital. And so the studies right now have really only been done on very, very, very sick patients. Basically patients that have been in an ICU, typically on a ventilator. And so I think a lot of the future research with remdesivir will be in patients that are a little bit less sick, hopefully earlier in the course of the illness. And I know that the manufacturer is looking at alternative delivery methods for the remdesivir. There's some talk of giving it as either a subcutaneous injection or maybe even an inhaled spray or a mist. And obviously that would dramatically change how we would be able to use that medication early in the course of the illness in hopes of improving outcomes.
Overall, as Alex was saying, we're doing better with understanding the virus and understanding when to intervene. We would start ventilator support earlier before, and now we wait a little later based on how patients feel. We're learning about the ability of the virus to cause somebody to clot and treating patients with anticoagulants. We're using plasma and able to identify true plasma that does have antibodies in it now. So the whole tool package we have with patients has helped us improve their care, and overall patients are doing better. We are seeing patients get off ventilators and leave hospitals.